How to evaluate your doctor for heart health. Key metrics you need to know. Hi, I'm Dr. Philip Ovadia, America's heart surgeon and your guide to optimizing your heart health through informed choices. Today, I'm going to break it down because most people don't realize the critical role that their doctor plays in managing heart health effectively. Here's what we're going to talk about today. Understanding the vital heart health metrics your doctor should be monitoring. The impact of these metrics on your overall heart health strategy, and the difference proactive versus reactive care can make in your heart health journey. Let's start by understanding the vital heart health metrics that your doctor should be monitoring. We're going to learn why blood pressure isn't just a number, but a gateway to understanding your heart's health. We're going to talk about the importance of regular blood sugar level checks and their direct impact on heart health. And then we're going to uncover the truth about lipids and why a deeper dive into your lipid profile could save your heart. So let's get started. Blood pressure isn't just a number. It gives you a vital insight into the health of your heart and the health of your blood vessels. Your blood pressure reflects how well your heart is circulating the blood around your body and what the status of your blood vessels are. If you have high blood pressure, it means that your blood vessels are getting stiff. And as that blood is trying to be pumped around by your heart, it is having difficulty getting that blood distributed to your body well. And over time, if you don't pay attention to your high blood pressure, it can have major ramifications on your health. Because high blood pressure, unaddressed, can lead to things like stroke and kidney failure. More important to understand about high blood pressure is that it shouldn't just be treated with medications. It's not just a matter of bringing the number down into the normal range, which is less than 130 over 85, but it's understanding why your blood pressure is elevated. What is the root cause causing your blood pressure to be elevated? More often than not, high blood pressure is an indicator of poor metabolic health. And if your doctor isn't addressing that with you, they are dropping the ball when it comes to your heart health. Now, another important metric that your doctor should be keeping an eye on with you is your blood sugar. And the good news is that most doctors do check your blood sugar on a somewhat regular basis. But the bad news is your doctor may not even understand that by the time your blood sugar starts to become elevated, your fasting blood sugar, you may have already had many years of damage being done. And that's because before your blood sugar becomes elevated, you become insulin resistant. You might be having elevated blood sugars that aren't picked up on your regular fasting blood test. So, hopefully your doctor is going beyond the basic sugar metrics. Has your doctor offered to you the opportunity to use a continuous glucose monitor? Has your doctor checked an insulin level, which is different than your blood sugar level and can be a much earlier indicator of problems related to your metabolic health? Now, another area where doctors check the basics but don't go far enough is when it comes to your blood lipids. And your lipids do play an important part in your heart health. Now, you may have heard me talking about what role cholesterol does and doesn't play in the development of heart disease. And what I want people to understand is that if you're only looking at the basic lipid profile, and if the more common scenario where your doctor has the basic lipid profile and they're only focused on one number, the LDL cholesterol, that means that you are not getting a complete picture about your lipids and how they're impacting your health. So you need to find a physician who understands the importance of looking at other numbers on the lipid profile, your triglycerides, your HDL cholesterol, and doing the advanced lipid metrics that can really tell you about the quality of your cholesterol, which is more important than the quantity of your cholesterol. Hopefully, by this point, you understand the vital heart health metrics that your doctor should be monitoring. Next, let's talk about the impact of these metrics on your overall heart health strategy. We're going to talk about how consistent monitoring can lead to early detection of potential heart issues. Then we're going to talk about the role of these metrics in tailoring a heart health plan that's right for you. And finally, we're going to cover some strategies for improving these key metrics through lifestyle changes and when to discuss medication options. So, let's start by talking about how consistent monitoring can lead to early detection of potential heart issues. Understand that all of these different blood tests that you might do with your doctor, most of them are changing, and some of them can change pretty rapidly. So if you're only checking blood work once a year, like most doctors do, you're just getting one little snapshot in time, and you really don't know what's going on with your body the whole rest of the year. This is why I'm a fan of more frequent blood work. Typically, patients in my practice are getting blood work done at least 3 or 4 times a year. And if we're working on changing things, we're going to follow up by rechecking those metrics that we are targeting. Even better is some of the continuing monitoring that we can do for some of these metrics. Something like a continuous glucose monitor can be so enlightening when it comes to your overall health. Now, let's talk about the role of these metrics in tailoring a heart health plan that's right for you. All too often, I hear about people going to their doctor and just being given the guidelines. And these guidelines are supposed to apply to everyone. But how can they? We're all starting in different places. We all have different goals that we're trying to reach, and you need an individualized plan. That's what I do with people in my practice. My patients work with me, my health coaches, and my entire team to understand where they're starting from, where they're trying to get to, and what is that individualized plan that's going to help them reach their goals and outcomes. So if you're not getting this type of individualized attention from your doctor, maybe it's time to find another doctor. And finally, let's talk about some strategies for improving these key metrics through lifestyle changes and when to discuss medication options. Lifestyle changes, I believe, should always be the first line when we're struggling on aspects of our metabolic health and our overall health. Understanding dietary changes, how your activity impacts your overall health, how sleep and stress both impact your overall health are so important. And if you're not having those discussions with your healthcare team, there is a serious deficiency. Now, medications sometimes need to be utilized or can be a good option. I don't think that they should be the first line that we talk about whenever we identify a problem with our health. But they do play a role in our overall health management. And what's important is that your healthcare provider is discussing how they fit into the overall plan of lifestyle changes and medications if they've proposed to you that medications are the only way to address your health problems. So, if you have questions or you need more information on any of the topics we've discussed in this video, please reach out and ask. Feel free to comment below and interact with my team. And it would be great if you subscribe to this channel for future videos. This helps our audience to grow, and as this channel grows, we're going to have even more great content on topics like this. So, before we wrap up today, I want to talk about the difference that proactive versus reactive care can make in your heart health journey. We're going to talk about identifying the signs of a doctor who is proactive about your heart health. We're going to cover the dangers of a reactive approach and how it could be putting your heart health at risk. And finally, we'll give you some steps to take if your current healthcare provider's approach isn't measuring up. So, how do you know if your doctor is being proactive about your heart health? The first sign is that they mention your heart health when you go to your visits. Do they talk specifically about what's going on with your heart? Are they measuring some of the metrics that we talked about earlier in the video? Have they talked to you about proactive screening tests like a coronary artery calcium scan? If you and your doctor have had conversations on these topics, that's a great sign. However, if they're not, you're dealing with a reactive doctor. And let's talk about the dangers of the reactive approach and how it could be putting your heart health at risk. All too often, what I see is that the first time that doctors pay attention to a patient's heart health is when they have a heart attack. And unfortunately, 1/3 of initial heart attacks can be fatal. And even if you survive your first heart attack, there's a chance that significant damage has already been done to your heart that may not be fixable. So that reactive approach, waiting for your heart disease to become apparent, can be putting your life at risk and jeopardizing your future. And if your healthcare practitioner is being reactive and waiting for you to develop heart problems, it may be time to find a new healthcare provider. And if you need to do that, I encourage you, use the resources available to you. Reach out to my team and see if maybe we might be the right partner for your journey. And even if we're not, use the resources that we talk about so that you can go to your new doctor and test them and find out if they're aligned with your heart health goals. I hope you found this helpful. Please subscribe, leave your comments below. We want to hear from you and we want to learn what you're looking for in your heart health journey.